Welcome back to the podcast. I'm your host, Jeremy Miller. Every week, I chat with fascinating people from all walks of life in order to bring you knowledge, inspiration, and insight. If you enjoy the show, you can support it by subscribing, leaving a review, and sharing it with a friend. This is the Jeremy Miller Podcast. Jordan, Jimmy, Helix Sports Medicine. Welcome to the podcast, guys.
What's up, man?
Appreciate
Excited to be
you.
here. It's awesome.
Yeah.
Stoked to have you here.
Excited to have you. Here.
You just killed me doing a VO2 Max test.
Yeah. How was it?
It was
Terrible?
It got exponentially hard.
Yeah.
Like, it wasn't bad because the whole test was like 16 minutes.
Yeah, just about.
And the first 10 were fine.
Yeah.
And then out of nowhere, it just got so hard.
Yeah, that grade A exposure up to like 18% incline with a 5.5 mile an hour. It doesn't seem like a lot, but
No.
crushes you.
No, I think I told you earlier, like, after it hit like 10 incline,
Yeah.
it kind of all just felt the same.
Yeah.
It just like the speed kept increasing. And it got like my lungs and heart, everything was just pounding. My legs were bricks,
Yeah.
but it's fun.
I'm glad you didn't faint and pass out on us.
I
You're
thought-
almost there.
Dude, I thought I was going to. I was in my head. I was like, okay, should I go till I pass out? But my vision was like tunneling and everything was like closing in, and I could feel myself like swaying a little bit more. And I was like, oh no, I don't think I'm gonna. This is going too good, so I call it quits. But
It would be okay. We have like the AED, CPR, and all that. We could hopefully save your life if that came to that.
You said I had a little bit more to push. You think?
Yeah. Like when I was looking at your graph when you were going through it, like you're supposed to hit this threshold where your CO2 output doesn't match or it becomes more superior than the input of oxygen you're taking in, and you're like kind of flirting with that line a lot, but you never fully cross into that aerobic threshold piece.
There's always a little bit more left.
Yeah,
Always
there's something
a
to
little
take.
bit more left.
Yeah.
You guys have both done that test, right?
I have not.
Oh,
no,
you haven't?
no.
Oh,
That one scares me.
Yeah.
I mean,
You're missing out.
yeah. I'll have to jump on it.
What do you think your VO2 max is?
Probably not very good.
Do you wear a watch or anything?
I've been running, so I mean, I don't think it would be terrible. I think it would just be the mindset of doing it. To be honest, I think that's probably one of the biggest things that would stop me a lot sooner.
Yeah.
Is, even when I do run, if I get into a long run, or what long run for me, if I'm getting over like 2 miles, like if I walk for a little bit and then start again, I do that. So that mental capacity of like not stopping, I think that would be my hardest challenge on that thing, for sure.
Yeah. You have to use the mental side too. Like, obviously it's a physical test, but it gets into the mental side real quick once it starts getting hard.
Yeah.
Yeah, dude.
You've done it?
Just watching you, that incline,
Yeah,
seeing you at that incline, I was like, that's probably where I would have tapped out.
Yeah.
Yeah.
It's rough. If you've done it, Jimmy?
Yeah, I did it when we were like first getting the machine itself. We ran through like a whole protocol, and then it was funny because we were all sitting in like the
We
actual
sacrificed
room.
Jimmy.
Yeah, basically. It's kind of. I'm like
We all
sitting there. I'm
looked
like, why
around.
me? I'm like in pants and like actual like heavy shoes. I'm like wearing my like Air Maxes at the time.
Yeah, he ran it in Air Maxes.
Yeah, dude. And like, so we ended up like going through and doing a whole protocol with the company. They do like a whole onboarding process for you. So you make sure, because as you saw, like doing the setup, it's not simple plug. Okay, it's ready to go. You got to constantly check some airflow issues and make sure you try to get as high as quality as possible. But we ended up doing it, and like same thing with you, no stretching, no like proper even warm up at all.
Right.
So like when I was going through with it, I felt like I could go longer for sure. Like I ended up doing like a 48 something VO2 max, not really training like cardiovascular.
Yeah.
But my legs got so tight, my calves got so tight from the incline, like I was like, it's not worth me pushing it and then like ripping some or something like that. So I actually had to call it a little early. I think I might be able to push a 50.
Oh, definitely.
Yeah, I could push a 50. I could push a 50 for
Okay,
sure.
Get some running shoes on.
Yeah, be ready for it.
Oh, yeah.
Give me a week. Give me a
Yeah,
week.
you did it underprepared, and you did well. So
Yeah. It's like you said, it sucked though. I was like barely breathing and
It's a
stuff.
very uncomfortable state to be in. It's only a couple minutes, but it just got so hard so quickly.
Yeah.
Do you experience that like in your like regular training at all? Or, like, is it only if you go out for a run?
You talk about when we run? Man, I think that when I was like in shape for running, I could get to that point where you hit the runner's high, but like right now, like even now, I'm 1 to 2 miles. I don't think I hit that threshold where I can just let go.
Yeah.
And I'm constantly thinking about, because usually I'm like, I'm gonna run this as fast as I can. You know what I mean? So I haven't really been able to hit that inflection point right there.
Does that come from like sports playing sports growing up? Like where you just want to go as hard as you can and not like pull back a little bit?
I say so.
It has to come from that competitiveness growing up too. Yeah, for sure.
How did you guys get into all this? Did you both play sports growing up and do this like kind of very fitness, athletic type of lifestyle growing up?
Yeah. For myself, I mean, I grew up playing baseball and football my whole life. I sustained like a stress fracture in one of my L4 vertebrae when I was in high school football. It's funny because it happened in baseball. I was in the outfield just running full speed and I dove for a ball and I landed like more on my upper chest. So, like the scorpion motion,
Yeah.
I basically did that and it whack, like hit and it caused that stress fracture. And it's so interesting. Like the thing that actually pushed me into like this realm, I would say, was the experience that I had after that injury. It wasn't the injury itself. It was the medical system in which I had to go through to get to the point of being recovered. Like I remember just being around like, general coaches and stuff like that. And they're like, oh, like you're fine. Just take a couple of days off. Did that. Didn't help at all. Turned around, met with my AT trainers. They really didn't know at that point in time. They didn't know really what was going on either. Ended up taking like 2 months off and then tried to go back to do a simple like sprint and it instantly started hurting again. So it was like there was something that was actually really, really going on. Ended up going to like the emergency room because I mean this was at a time when I was still trying to do like moving from like high school baseball, summer baseball into football. I walk home and like get in, like open the door and eventually get in a fetal position. I'm like, I live with my grandma. I was like, man, I can't do anything. I'm gonna just lay right here. Jeez. And she got fed up with it. Took me to the ER and they went through and they looked at it and they were just like, they literally told me like I pulled my hamstring. And I was like, what? I was like, this thing is like in my back. You know what I mean? I get it. Your hamstring attaches pretty high, higher than what you typically think. But man, it was like in my back. It was real, real bad.
Tight hamstrings.
Yeah, dude. And they ended up giving me a cortisone injection into it. And then they gave me some painkillers. And then like, I'm like, all right, I feel a little bit better. And then, I mean, I'm in high school and I was getting prescribed like a painkiller. You know what I mean?
Jeez.
Like
I've heard cortisone is not good either.
I mean, they have their place.
It depends, right?
Yeah, they have their place for sure. Like when people are flared up and it's even causing a lot of like not injury, but at least pain. Like getting a cortisone injection can really change a lot in a way you make you feel like
it can drop your threshold so that then you can actually get into rehab and start doing things that your body needs to do. But it's definitely not the solution. Right?
Yeah, by
you're
any
not just
means.
going to get a cortisone injection and then be like, everything's healed.
Yeah.
That's not how that works.
Yeah. And like that's the thing is like, like even now you have so much in the fitness space of you got to be natural. You got to do everything natural. It's like, bro, medicine is still advanced and it still works very well and it has its place. Like if you need, like, we're not scared to send someone out to go to an orthopedic office to get an injection anytime because we know that it gives us an opportunity to get back to the goal when we need to.
Yeah.
But it has its place. You only get 2 a year typically anyways. For a cortisone injection.
Yeah, because I think it was on Joe Rogan's podcast or something. Somebody's talking about how they're like limiting how much cortisone they give out because there's some like new study on it or some shit. I don't know what it was, but maybe just it might be like a once a year or twice a year kind of thing where it's like I know some NFL athletes will do it like before every game or something, and they're trying to limit that. I think
that's usually
I think
a
that's
Toradol
like
shot.
Oh, maybe it's Toradol.
That's a Toradol shot.
Okay,
yeah.
I probably have them mixed up then.
Yeah, but like
I mean, I'm pretty sure back in those times too, I'm pretty sure there was probably cortisone used for pre-post game stuff. Keep people moving.
One of the big issues.
A lot of money on the table.
Yeah, one of the big issues with the cortisone shots is like it elevates your blood sugar like crazy.
Really?
Yeah, so like diabetics, like there's a limit, and then like even like
tendon health,
tendon
right?
integrity. Yeah, it eats away at your tendons. So it actually like it's good for an inflammatory response, but you can degrade a tendon pretty easy, getting multiple injections quickly.
So that experience of like having all these misdiagnoses and nobody really knowing that sparked you to want to try and go into this field?
Yeah, for sure. Like it was more of so it's like I went to multiple docs. Like it was more than just like seeing one guy and he prescribed this, but then getting on like the painkillers. And there was a time where me and my buddies, we had to travel baseball, so we had to drive like 3-4 hours away for the tournament. And I was like still popping the pills just to play into the tournament itself, just because like even swinging a bat, like I would swing a bat and then stop at first and they would pull me out because I was like, I can't run. Like it hurts that bad. So it's just enough to be able to perform a little bit. And there was like one night where, I mean, I started dozing off and I like ran off the road a little bit, hit some cones, and then I had to lay in the back seat in a fetal position and have my friends drive because it was like I was in that much pain going through that process. And then finally being able to get into someone who looked at it, I got an MRI and everything. They're like, why are you doing anything? You know what I mean? I'm like, that's what I've been saying. Like no one believes me, especially high school kids.
Yeah.
You know, you don't, when you hear back pain, you're like, oh, you're going to be fine, bro.
Yeah.
That's where like when we have those kids come in here and they tell you about pain, the thing about a kid, they'll do anything at all costs to play. So when they're hurting and they say they can't play, that stuff matters a lot. It's like one of the biggest pieces of advice I ever received from a professor. He's like, when kids have pain and they can't play, like kids, that's the only thing they want to do is play.
Yeah. There's a small percent of kids that, is the opposite where they don't want to play.
Right.
Yeah.
Right.
Their parents are making them do it or something.
Right.
Yeah.
But when you look at a total or a whole population of that, it's very, very small. So most of the time when kids complain of pain that's taking out of their fun, they're telling the truth.
Yeah.
And you got to take it serious.
Parents on the other end are like, they really don't know.
People don't know.
Right.
That's the thing. People don't know. And then with some things, it's just, have that deal where they go to that traditional medical route of like, well, just take some ibuprofen and rest. And a lot of times that's just not the answer.
Yeah. What is it? The rice method? I've heard that's kind of been
That's no
debunked.
longer a thing.
Yeah. I think the guy that came out with that in like the 80s or whenever that was, he came out a couple years ago and he's like,
he revoked it.
Yeah.
Well, who is it? The Squat University guy. He's always
yeah.
all over that, right?
Yeah.
Because he's the one that talks about how even that guy who made the protocol, it was like 20 years ago when he already reversed it, but somehow we're still living in this time that it's still a thing. And what was the statistic? It takes
about 17 years for medical literature to be delivered to the masses.
What?
Yeah.
They
so
can
like
change something.
we're far behind what science is already out and saying.
Jeez.
You know what I mean? And it's just the process. It's like, it's not that it doesn't become popular, it's to it become accepted as a standard within the population itself. It's a 17-year process.
That's wild.
Yeah.
What do you guys do to like try and stay on top of that so that you're not living in 2008 or whatever that would be?
Yeah.
I mean, you have to stay up with like, the new literature that comes out on stuff. And then, it's easier for us to say right now because we just got out of school like 4 or 5 years ago. So we have the new information now. So I'm sure, in 10 years, it's going to be something where you have to just stay on top of it.
Yeah.
You can't just keep living in what you learned 4 years ago.
Yeah, I feel like I'm always seeing some new thing on Instagram.
Yeah.
Somebody doing some crazy protocol or some like movement or something. And I'm like, is there any merit to that? I never know because then it's like a couple of years down the road, you're like, okay, that seems like now there's a lot of people doing it. There's science on it or studies on it. How do you like weed out some of that shit? Because there's like people doing it for clout all the time.
Yeah. I mean, weeding it out is like the hardest part for sure. I mean, you got to challenge the standard to have innovation. You know what I mean? So, I mean, all in all, it's like research isn't end all be all for sure. I mean, there's so much that goes into like the human body. Like people will like cite a study that is so concrete and it's like, I get it, understand it. And I agree. But at the same time, that doesn't work when you're talking to every single person, every individual person basis. You know what I mean? So, I mean, even like ourselves, like you said, like we have more so the new information that's actually out here, but at the same time, you still got to push innovation. You've been in here and you've done therapy. If you go to like a traditional therapy office, we're definitely not like them by any means. Like when it challenges, like when it comes to like movement, like we're big into movement literacy and movement variability. Like you got to be able to move in extreme capacities to kind of prepare yourself for the unknown. Like you're talking about like injury prevention and stuff like that. I mean, really the way that you're going to get injured is if an external force is being placed on you when you're not ready and never exposed. So you got to prepare for like very awkward stuff. And that's not just, increased mobility, and it's not increased strength. You got a positional strength. Like a lot of people in the baseball community, they try to do that, or even the rotational community, but you got to be able to expose in very awkward positions. Like a lot of the training style like Pat does, he's very resilient with his injuries because of those regions. Like he has excellent strength and conditioning coaches with him.
Interesting. What does that mean? Does that mean like sitting or moving in certain ways and then placing a load on it, or like, I don't know. What do you mean by that exactly?
Yeah. So, I mean, imagine like trying to bend and hold load at a bend. Like you're not typically exposed to that when you're doing like sagittal and frontal, or even transverse plane, like actual exercising, like putting those into those positions, be able to hold them for a period of time. And then just like any other lift, like progressive overload on it, to start little and kind of build it up. So making it move funny, use it, and for one, it's really enjoyable to do once you get into it. And then you'll notice like some people, they just can't get into positions at all to do it. And then when you kind of expose it to them, you're like, see, this is probably what happened.
Yeah.
You know what I mean? You've never been prepared. You've never been able to, think about like the sport of football. People get smacked and then they constantly bend into positions, so like preparing it for that.
Is this something that's taught in school? Like, did you guys learn this in school, or is it something you learned through
other people?
Anecdotes, or
just observing the right people and what works, and just taking a little bit of this from somebody, a little bit of that from somebody. I think that's something that like me and Jimmy do a really good job of too. Is like even like you're asking like, well, these protocols or these like literature, like how do you know which one's the right one and which one's not? But like at the same times, like, I have a patient comes in and they're like, I iced my knee and it felt better. Well, ice it then, right? Yeah. Like we're pretty good at not just being stuck in one way. So like a patient may be like, this works for me. Okay, let that work for the patient. Don't try to change that all the time, right? You can only advise people on like some good literature or good movements, but some things may work for them that don't work for others. And it's not just trying to change that, but it's allowing to let what works for your patients, let it work.
Yeah. It seems like not giving too much power to data or like what other people are doing. Like I heard this, he was talking more about like business, but it was a Jeff Bezos clip I saw, and he was like, when the data and the anecdotes don't match up, usually the anecdotes are right, meaning like something is wrong with the data probably, because if you have so many people saying this one thing works but the data doesn't quite match, then usually it's the people that are right most of the time. I feel like that goes into a lot of fitness stuff too.
For sure.
I mean, you mentioned it earlier, like intuition, what I mean? Like, and I wholeheartedly believe that some people have better intuition than others when it comes to their body. Like some people, they don't, like if they close their eyes and move their arm, they don't even know where it's at in space, But some people can tell you exactly what's going on. They can pretty much diagnose themselves, and it's usually pretty accurate. I mean, obviously there's thresholds to that, but the intuition of what people, how they feel and how they move is like a big key for us. There's always an additive of what they say is like, listen to your patient. They'll tell you the answer. It's easy.
Listen.
So after you had this back injury, where do we go from there to get to going to PT school and everything else you've done?
So I finished.
I'll get to Jordan in a second. Probably.
Hey, all good.
I ended up like
his story's cooler.
I ended up going through and I got that MRI and everything, and they found that stress fracture, and basically I went to the doc and he's like, you're done. He's like, you're not going to be, and this is like heading into my senior year, like high school football. So it's extremely important. You know what I mean? And we're supposed to be like super good. And I have to like go tell the whole team that like I'm not a lot of play, because like there's that risk factor of it's a stress fracture and it wasn't healing. There's that point of where if I get hit in an awkward position and take that force, like it could crack through and maybe hit my spinal cord and like cause the result of like being paralyzed or something like that. There's always that possibility, right? So I actually ended up being able to sit out. I rehabbed, and oddly enough, is like I did exactly what I was to do to a T. I had to wear a brace and a harness that like keep me vertical, so I really couldn't stress it out a whole lot. Which
This
was
in high school?
yeah, in high school. Like I was like sitting there and like to talk to people, I had to like turn like this. Like it was terrible. But you know what? It made me super skinny because the compression on my stomach was crazy. But it made me a chest breather. Like, but I ended up finally getting it diagnosed correctly. Did PT for a while, and that kind of led into the spark of like, man, this is actually really cool. So I had really good influences after I got it corrected. But it took close to like 8 months to get back feeling good. I was going to miss the whole season. Got told I was going to miss 6 games, and then I only missed 1 game. But I had to wear like like 5 braces on my back. I looked massive because I had so much padding on my back.
Don't mess with that guy.
Yeah. I looked intimidating all out there, like
185.
Yeah. I looked heavy. I wasn't heavy at all.
Dang. And where'd you grow up at? Was it in Texas?
No, I grew up in Springfield, Ohio.
Oh, okay.
Yeah.
Did you go to school out there too?
Yeah, so I did my undergrad at the University of Cincinnati, and then got my doctorate degree at the University of Dayton.
Nice.
Yeah.
When did you move out to Texas?
I moved out to Texas 2.5 years ago.
Yep.
Just about. I like ended up like finishing out school and stuff. Worked for a little while. Ended up meeting some people in the sports medicine realm. They flew out, interviewed me, took me to Miami. Worked in Miami for a little while, and then this is getting to the part of where I met Jordan. The people that I was working for were purchasing a company called APEC. It's where it's basically Patrick Mahomes' training facility that he trains at.
His home gym.
Yeah, his home gym. So once they finish out the purchasing of that new company, I relocated to Fort Worth, and then we started up their medical division out there. So we were like one of the first physical therapists, and he was like the first chiropractor out there. Dang. And then that's where we met. We started working together.
That's dope.
Yeah, super cool.
Dude.
That's how we met.
Dude. Your turn. Now, how did you get into all this stuff?
Dude, I think probably there's a common denominator for most therapists about like, going through an injury or this or that. And it's right up the line of that is like, I'm the most injury prone person I think ever. Like you name it, I've had it, right? That's just happened to me. And, it's like one of those things, you're a high school kid. It's frustrating. Like Jimmy said, wrong direction, not so much dude, I grew up in the middle of nowhere. So like there wasn't this like high training, sports medicine kind of community. Like you see these like big cities with a lot of good sports teams and stuff like that. So not much direction in that, but it was one of those deals that I finally had enough injuries and worked on myself enough that I was like, dude, I better do this for a career, right? Like if I can fix myself and, work on these things, then I need to put my passion and all my effort into helping others.
Dude,
so
that's great.
That's along the lines of just being hurt all the time.
Yeah. What sports did you play?
Basketball, football. Yeah. I tried to play football, got injured, rotator cuff, surgery a sophomore. And then it may have been it was freshman or sophomore year, rotator cuff, went to PT for that, kind of fell in love with kind of the ability to get better and rehab things because, in that moment, you're like, I'm done forever. Mm-hmm. Like my shoulder doesn't work, right? Especially after a big surgery. And it was one of those things that, am I going to be able to play basketball again? Am I going to be able to play football again? And then that rehab path like set you back to your normal life. And I thought that was like a really cool thing. So it sparked at a really young age. I think I told myself I was going to be a physical therapist or a chiropractor since I was like maybe a sophomore in high school.
Dang, that's cool. Yeah. Are you still passionate about it?
Yeah, 100%.
I mean, you guys are killing
I'm always
it.
injuring myself still. So still training, still, injuring myself. And, it's one of those things you hate to have that type of stuff for yourself. But at the same time, God puts things in your life to, help others with that. So that was like a really cool thing that I've kind of found where someone hops on that table and they're like, I tore this. And I'm like, me too. Let's go. Like,
I get it.
I get it. I know exactly what you're saying.
It probably gives you a lot of extra, I guess, experience and knowledge, right? Because you've probably had so many injuries.
Relatability.
Yeah, exactly.
That's huge. It's just being able to connect with them on a level that, like, he's done this, and like, he's doing this now, and I will be better. And giving people the right timelines on stuff, right? Like I didn't heal as fast as a lot of other people, so I give people a realistic timeline of like, you just tore this, dude. It's gonna be a while, right? Not being like, you're going to be ready next week. You know, you're going to be, because you don't set these like false expectations for people. You know, it's like I healed slower. So I let people know that this could be what it's like to give people, you know, the reality of what's going on with them.
Could people like actually be more prone to injuries just because of like genetics?
100%. Yeah. We talk about this all the time about EDS, right?
Yeah.
A lot of kids with, there's a big spectrum of it, right? Of just being too lax, maybe more developed in areas and not in some. And then, you know, just the ability for a joint to be overloaded and it can't take it anymore because of a genetic factor of things. So like a lot of flexibility. We talk about this all the time with kids that are super flexible or super this. And it's like, sometimes that's not a good thing, right? Everybody wants that mobility and that flexibility, but a young athlete, you want to be springy, you want to be tight. Like these are good things attributes to have. So I think it definitely could be a genetic thing where most people are prone to injury.
Interesting.
Yeah.
That makes sense. Is there anything you can do really to like help that? Like for in your instance, for example, can you do anything? It's like you just kind of have to go through life expecting you might be injured more than the average person.
Yeah, I mean, I think there's a lot of things you can work on, but life's not perfect. So, you know, you're always going to push yourself until that limit, and then you never know when that's going to be. So I think it's one of those things that you can do everything you can to help prevent and do the right things for your joints, but you shouldn't be scared of continuing to train and continue to push yourself. You know, those setbacks are just ways that your body is healing again, and then puts you back on path. So it's the journey of life and the active adult or athlete life.
Yeah, you can't be afraid to go out and do stuff just because you might get injured or something.
Absolutely not. Yeah.
Yeah. Dang. So did you grow up in Texas?
I did. Yeah, out East Texas.
East Texas. Is that like over by
like Tyler?
Louisiana?
No. Yeah, about an hour from Louisiana border.
Okay.
Yeah,
nice.
something like that.
And how did you end up in Fort Worth?
I was working with a chiropractic office in Frisco, and I was kind of...
Frisco's a dope little town.
Really, really cool area. Like super new, developing.
Yeah.
It's huge sports world, soccer world. I mean, it's just a really big place to be. But, you know, just being there, trying to make my mark on like high school kids of like, that was like my niche of working with high school athletes. Did a lot of like social media stuff for myself, which isn't too crazy compared to a lot of social media stuff, but just putting it out there, right? Exposing, letting people know what you do. And then luckily enough, a NFL player came to my office and he was like, wanted to get treatment. And then after the treatment, he was like, you want a job?
Was he a Cowboys player?
Ex-Cowboys player, yeah. Yeah, and he was like, yeah, let's get an interview, let's do this. You know, I mean, he was trying to hire me like in the clinic.
At his other job.
At my other job.
Like as like a personal like trainer for him?
No, for the potentials of him buying out this APEC.
Gotcha.
Yeah.
Okay.
So we did, went through some interview processes. He told me to a point that it's like buying a house, right? It's not for sure. And then, 3 months later, he was like, all right, it's for real. Here's contract. You want it or not?
Dang.
And then made the decision to do it. So
that's cool.
Yeah.
So you guys were in this clinic together for how long?
For about a year and a half.
And then you said, screw it, we're doing our own thing?
Yeah. Like, it just ended up, honestly, I think it really just comes down to fate. He wants me to tell a crazy story.
Let's hear it.
No. So, like, it just, like, kind of came down to fate. We ended up getting connected, and someone reached out and just offered this kind of space to us, like, inside this warehouse. We kind of, like, looked at the area. We saw, like, Westlake was down here, LT, Vandergrift. And if you look over really in this area of Austin, there's not many like high level or even with the experience that we have in the sports performance sports therapy realm. So like come down here looking at it, it's like, dude, there's a huge need that is not here for some odd reason. So we actually, a couple of times we drove down here on the weekends, scouted the area out, met with the owners, talked to them, went back and forth. And then we ended up finalizing some stuff on paper and decided to make this the next journey.
Dude, that's cool.
Dude, it was crazy.
What was that transition like because you guys were in a clinic, right? Before like working under somebody else?
It was us.
Yeah, it was us.
Like it was us. We were there. It was it was like in a sports facility like this one.
Okay.
So like we still had people but it was predominantly just us, where we just like hung out. We were around each other 24/7, grinding away, and then figured let's do this stuff for ourselves if we're going to do it. You know what I mean?
Yeah, I think you hit a certain age and then, or age in your life or a part in your life where you just know there's another step and you're on that cliff, and you know, it's like, if I don't jump now, like I'll be here, which would have been a good spot, right? Like we would have been amazing spot. We'd have had the careers that, you know, that we wished for and, you know, brought to ourselves in a lot of ways. But it was one of those moments where you kind of just looked at each other and was like, screw it, dude. Let's jump. Let's try it.
That's cool.
Why not? Right.
Yeah.
So are you doing basically the same thing here that you were doing in Fort Worth, or is it like? So did somebody own that, and you guys were kind of like you ran
Correct.
it?
Yeah, we're employees.
But
for
now
sure.
you guys own this.
Yeah.
Yes.
And obviously do everything hands on too, which is cool.
Yeah.
How's that been?
A lot. But it's been good. I mean, we've been super blessed to this point. I don't think there's a moment where we thought that this thing wasn't gonna do well.
Yeah.
I think we prepared our lives for this for a certain thing. Like we talked about this. We were doing well, kind of moving into our new space or doing this, and it was like things were moving fast. And Jimmy kind of looked at me. He's like, "Dude, could you imagine that we were doing this well at this time?" And I'm like, "Yeah, dude, we've been studying for this test forever, right?
Yeah.
Like we've been studying for this test for the last 3 years, and how we've been doing stuff. Like we were ready for it." And I think that was the easiest decision for us to jump and do it too. It was just like we felt so ready. So
That's cool.
it's been awesome.
It's nerve-wracking leaving a high income on your salary and going to make $0.
Yeah.
You know what I mean?
Did you guys have to live like a little?
Dude, we moved in together.
Yeah.
No way.
Yeah. Us and our wives.
Yeah.
All four?
Yeah.
Yeah.
We moved in together
Oh,
so
wow.
that we could
Dude, that's a
take a
grind.
little bit off rent, right? And it was like, what can we do to minimize the risk as much as possible? We knew that me and Jimmy would be at the clinic most of the time. Our wives would be, you know, a little angry at us times for being here a lot, but they had each other, so it worked out. It worked out beautifully, man. It was awesome.
Yeah.
Shout out to the wives for support.
Dude,
Definitely
that
shout
takes
out.
some real support for
Yeah.
them to be willing to do that.
Yeah, I mean, it's tough, and like even as your like business relationship, you know, like your friendship's still a priority, you know, because a lot of people don't mix the business and private life together. But I think that's one of the things I value most about him. It's like even if he's not my business partner, he's one of my best friends since moving down to Texas, and like having that opportunity to be around each other enough, well, freaking living with each other, right?
Yeah.
Like you get to learn a lot about a person, and then you get real comfortable in a sense. It's like I could trust him with anything, you know, and having that type of trust and confidence in someone, it makes the functioning of the business a lot easier.
Yeah.
Like I know that he's going to make the right decisions every single time, no matter what. Like even if I'm involved in that process or not, like I trust his judgment. I trust his opinion on what he's going to do or make the decision, and it's going to be the correct one, no matter what.
I love that.
Yeah.
How do you guys split up your roles within the business?
We're working on it.
Yeah, it's tough. Like, you know, when we come in, we're trying to split everything in half, and then you just find out that's not the most efficient way to work. Like some things need to be like individualized. Like you need to put a focus on this, you need to put a focus on that, and it runs a little bit smoother. But we actually just got back from Mexico, and we talked about some of those things, like trying to set some roles, and then like personal preference. Like I freaking love numbers, and I love like management of some things. So it's like I gravitated towards that and wanted to do that. So I guess it's like a personality type. You try to figure out what fits and what's sustainable for you as a person, so you don't feel overbearing by everything.
Right.
Yeah. I think the biggest challenge of that so far for us has just been how busy we've gotten so fast. And then you get so busy, and then you forget about like that aspect of like business on like, what are your roles, right? Because, you know, when we both see 10 people in a day, it's like, did we even get to accomplish our roles of what we're supposed to do outside of seeing people, you know? So, which are all good things, right? Like you want that. Not saying you don't want that. So it's like, we've been blessed. So it's been cool, but we're still figuring out. We're not perfect. And there's a lot of things that we got to change and move to the right direction. And, you know, we figure it out day by day.
Yeah. And one of my favorite sayings with business is, especially a service-based business like this, is if you're working in the business, you're not working on the business.
Yeah.
Yeah, Jimmy says that a lot.
That
is Jimmy's
it's one of the
favorite.
hardest transitions to make, though.
Yeah.
Because like, especially if it's like you love doing PT and chiropractics and stuff, like
Yeah.
it's hard to let that go and go to the business side, because it's, I mean, that side's kind of boring in my opinion sometimes, versus being able to be hands-on and help people and stuff. And that's why you
100%.
started the business to begin with.
Yeah,
Absolutely.
yeah, because you got to take away your passion a little bit of wanting to just
Right.
always be with patients, and then step outside of that.
Yeah.
But that's something we're getting into sooner than later. So it's
Getting better at it.
getting better at it.
Like entrepreneurship is so tough because it's like, I mean, you're fighting in the dark, like literally what you're doing, and then you're gonna make a mistake and you know what not to do. So try to. We always say is like, don't let the grass grow under your feet. Keep moving, keep doing something, start something, build something. Just keep moving forward. Things will happen in a good way if you do that. And if you do make a mistake, that's fine. Do 15 other things that correct that one mistake quick. So if you do things quick and move fast, usually when you make a big mistake, it's really minimized because you've done so much in advance or more after that. It doesn't even really catch up to you. You see what I'm saying?
Yeah, yeah. What do you guys think you've been able to do that's allowed you to grow so quickly and have success as a new business?
I think it's like us and then our way we connect with people.
Yeah.
I think that like we vowed to ourselves when we started that everything's going to be a relationship. Like it's a relationship basis. Like we put the people first all the time, no matter what. Like there's a lot of times where, you get to a point and people start becoming numbers, and like we never want to be to that point. So we'll prioritize relationships, and I think people understand it. They see that. I mean, we give a lot, we do a lot for people. And like when you have someone who cares as much as you care about yourself, like it goes a long, long way with them.
Yeah, yeah. I love that.
Yeah, it's definitely the relationship-driven first model that we came down with. We just knew that if we were to succeed into our business, what you define success, it wasn't like how many patients do we see this week, but it was like if we have that as our first and foremost of making sure that every patient feels that they're more than just a patient when they come through these doors, we knew that was going to be success. And we stayed true to that, and I think our patients feel that, and I think that's why so many people love us, on that end. It's a cool environment to be in here with us.
Oh,
so
definitely.
It's cool.
It definitely feels like a different kind of PT clinic.
Yeah.
Where, like I've been in some and it feels so like clean. I don't mean that. I don't know what that's the right word is. It's like it feels so like corporatized and like
Oh, for sure.
I don't know the right word.
Because those are number-based things, which in the business world work, right?
Yeah.
I mean,
Like there's no character to it.
Yeah.
Yeah.
Like there's like people in our patients, they'll invite us out to all the parties, everything like that, to just mingle with them because they like to be around us, and that's one aspect that people like when you go to therapy and you're doing therapy, you don't enjoy it because you're typically hurt. But we'll have patients like for example, we had a girl.
this is funny. This is actually
so like
funny.
the mom asked her, she's like, what do you want to do for your birthday? She's like, I want to go get treatment. I'm like, that is the coolest thing, you know what I mean?
Yeah,
That's funny. I love
this
that.
is a 9-year-old who on her birthday is like, I would maybe not rather be at Helix, but like I don't want to miss my appointment. Like I love coming here, and so that's what I want to do.
That's so
and
cool.
when you hear a parent tell you that, it just like hits different on like when a parent tells you that, it's like one of those glorifications that you're doing the right things, right? Like you're allowing people to get connected with you and want to be here, and that's super important in our realm because a lot of times people don't want to be in therapy. They don't. They get hurt and they're like, oh, I got to go to this appointment. I got to do this. And they're not motivated to be there. And I think that could be a big correlation to why we have so much success with our outcomes as well. People want to be here. They get the work done that they need, not what they want. And, it works out both ways, right? People get better, and then people like us, they tell people about us. It goes a long way outside of this.
Do you feel like as much as it is physical therapy, there's some like an element of some like talk therapy too? Of like,
oh, 100%.
Yeah,
we are that. We are the whole therapist at that point.
Yeah, you have to be a, what's the term, like a chameleon. You have to be able to talk with people on random stuff. It could be stuff that was out of the blue, that you're like, all right, well, your knee hurts and you're talking about this, but like you have to engage with them and go along with that conversation, and you have to support them in that conversation that they're struggling with that day. So I think that's another thing. It's really, really important to stay involved with your patients.
That's cool.
Outside of that too.
Yeah. I found that with like run coaching too. Like as much as it's just writing workouts and helping people fuel and do that stuff, you end up being like just a therapist more than anything, or like a friend, and just like talk about everything except for running sometimes.
Yeah,
which is cool.
So you have you have experience with that too. On like you have to gain the trust of your patients. They have to know that they're with a good person,
right?
And you have to let people in, and you have to let people know who you are and what you're about, and it goes a long way. People stick with you forever.
Yeah.
Right. Rather than doing like one training cycle with you and then being like, I got some results, but whatever. Like someone who connects with you probably could only PR by 30 seconds and they're going to be like, that was amazing. Right. It's an experience in which you bring to your clients or your patients.
Right. Yeah. We're social creatures for sure.
100%.
Yeah. What are some of the like pillars of Helix? Like what are kind of some of the services and things you guys do here? Cause it's definitely, again, more unique than what you'd see at a typical PT clinic, I feel like.
Mm-hmm. I would say like one of the main, like other than like the relationship being like a pillar of what we do, like we try to keep everything as open and honest as possible. Like I think one of the big things like within the medical community is the fact that you get a lot of dishonest opinions about things or unrealistic expectations. Like you said you've done therapy in the past before. There's some things where you can actually fix them quite relatively fast, and then kind of like set them up on a way. It's like, hey, you can go ahead, you can do this for yourself, and it can heal really quickly. So like keeping like honesty with our relationships. We prioritize like the whole holistic approach to everything and try to give them the environment of which they want to do. So if I had to like break it down in pillars, I was like relationship established, like honesty is priority for sure. Having like a holistic approach, and then not being afraid to utilize necessary items. You know what I mean? If you have to come in and you have to end up going out to an orthopedic because where the results are, or where the skill or where your limitations are at, like you have to be able to make those decisions and not thinking that you can fix everything or heal every single person. So keeping that honesty is a major one for us for sure.
Yeah. I mean, we combine what we do well. So I think that's a cool approach about what we do as well. It's like you have a chiropractic minded background and then a PT minded background kind of merged together to give our patients almost every spectrum that you can get within rehab. And I think that's a really cool thing. So, I mean, I don't want to say we do it all, but I mean, we give a lot to our patients. Yeah.
Yeah. You guys do a lot here. Like even when I came in, I think it was when I was training for Boston, I had like some weird hip thing going on, and you did like 8 different things on me. I don't know which one of them helped, but one of them definitely helped. It was like, I think my favorite thing, what seemed like to help the most, was the electrical stimulation with the dry needling.
The dry needling, yeah.
Oh yeah.
That was incredible.
We showed a little cheek on that one for you.
Yeah. Remember the Instagram post?
Is give the people what they want.
Yeah.
Like what's the like what do you guys spend the most time on in here? Is it like the recovery stuff like that, or is it rehabbing things, or working on people with prehab, or is it like chiropractics? Like what does that kind of look like?
Yeah, I think it's a unique blend of like if you had a 50-50 in it, it's almost like that because we have it's like even like in season, for example, for football, like we'll get real busy during high school football season because I mean they're constantly getting banged up, right? But it's not like that they're having the serious injury where they tore something, so it's like we don't have to do like a traditional rehab approach to that. It's more like an active recovery and restoration process. So we'll kind of prioritize it that way, just depending on the athlete or the person and which they're kind of searching for. We have some people that just want to come in and then like they'll be like, hey, I really want to do these couple things today. I'm like, okay, as long as that fits in why we're here, like we can do those, So given some ability to create like an environment where they feel like they can have an input in what they're doing. I think that, to the whole point, I think that it's a mixture of all of it, sure. Because we have a ton of athletes, we have a ton of active adults, and they're all going to continue to play the sport or continue to be active. So it's like management more than anything. I think that's a difference. To your point, I think that's the difference between traditional rehab and what we do. It's like athletic and people management rather than pure rehab.
Yeah.
I'm trying to guide you and keep you to do your sport. Like a runner, you know what the worst thing to tell a runner is to stop running. You know, like, because they usually don't do that.
Right.
So it's like, okay.
They're not coming back if you say that.
Yeah. So it's like, all right, so I know you're going to run, but how about we manipulate these variables? And then they kind of see it from like a coaching perspective rather than be like, all right, let's just do these exercises and then you're going to rest for the next like month or whatever. It's like, no, you can't do that with active athletes and active adults. It's not going to work.
What's like a typical protocol you'd give to a runner? Like, just because a lot of people that listen to this are definitely runners. Like, if say somebody comes in and they have like shin splints or something, like what's a protocol you'd do so that they can continue to train, but maybe manipulate some of those variables?
Yeah, I'll let you talk about the runners.
A protocol for like shin splints,
Or just like something minor where it's like not debilitating.
Yeah. Okay. So we kind of break that down to like where they're at and their like pain levels and where they're going. So I base a lot of stuff off like where they're having pain at and also like the level at which they have pain. So we look at if they're still running, 5 miles and they're at like 2 or 3, I'm okay with that. So I tell them like, keep running, because as a therapist, we need that information as well, because if we completely shut someone down, say, hey, stop running, right? Don't run for 2 weeks. And we do a traditional kind of rehab for lower extremity stuff. And then we have them jump right back into mileage. Like, we have no information if we're getting them better. Whereas if you can just tweak the variables of saying 5 miles, it gets to a point, all right, let's knock it down to 2 miles. Let's take your pace up. Let's take your pace down. Let's find that variable that fits you and that you can stay consistent with your run. And then that way, when you do get back to that 5 miles, you can be like, it was a ton better, or it's actually better. My pain level is a 1 or 2 while I was doing that. Okay, we're on the right track. Let's keep going. I would say that's probably, I don't know if that's the right answer for it, but it's like a protocol that we have is really just managing our athletes to a point where we don't take them out of play. We give them enough stimulus to keep them engaged with their sport or their run while we're fixing things on the back end so that in 2 weeks' time, they're ready to go.
Yeah. Do you guys get a lot of runners in here? There's a lot of runners in Austin.
Yeah, we turn into the running clinic pretty quick, I think. Very fast, which is a pretty cool story on that end, too. We had Mitch come in here, Amons.
I was going to ask you, has he done the VO2 yet?
He hasn't. We're trying to get him set up for it.
He's going to be...
He's going to break that
be a
80.
beast.
Yeah.
But he came in here, worked with him for a little bit, and then immediately, I think as soon as he got off the table, he was like, here's my running coach. Y'all need to get connected with him. And then week 3 of being here, we had 4 Olympic trial people in here, running. And, it was one of those things that it just shot off so fast for the running community to find us, because in running, you have something coming up, and they go to another place that's maybe a little overbooked or whatever. No, it has nothing to do with how like good or bad the place is. It's just availability at that time. And we were so available for our runners that they cling to coming here because they knew, hey, if I've got a race in 2 weeks, I could call these guys and get in as soon as possible, rather than what am I supposed to do for the next 2 weeks? Wait on wait. So it's one of those things that just like that availability for runners, getting connected with the right people, and the results that we were giving out to our runners, and everyone noticed that. Everyone starts talking in the running community, so it blasted off pretty fast on getting runners in here.
Well, when you run, you talk, right?
Yeah,
you got a long run.
You
got a lot to talk about. Yeah. So it spread pretty quickly after like, oh, I've been seeing these guys, and then I think those runners told runners, and those runners told other runners. It's been just like spreading like wildfire for sure. Yeah,
I mean, the Austin running community is crazy. It's so big.
Yeah, I don't think I've seen a running community like this at all.
Yeah.
Being from around the Texas areas, I've never seen such a positive thing for like Austin. I know it now as like a running community. Yeah. Like it really is.
What percentage of people that come in here are runners? Is that like the predominant?
I would say as kind of active adult wise, I would say if you're looking at non-high school athletes and you're looking at active adult, I would say it's probably 30 to 40% of our population.
I think that's a good guess for sure.
Yeah.
Running is a very injury-prone sport,
Yeah, it's a good cycle.
especially
You're
for
gonna run
older
a lot.
people, because
Yeah.
usually they get into it later in life,
Uh-huh.
and it's kind of one of those things you have to like. It takes so much time to build up to it.
Yeah.
Just if you come in a little bit later, you're probably even more prone to injuries.
Yeah, for sure.
Yeah. What's like is like a common thread between runners that you guys see come in?
The Achilles.
Achilles.
tendonitis. Yeah.
Achilles.
Achilles
Yeah.
tendonitis.
Really?
Shin splints, not so much. I think Achilles is probably our biggest thing. Hey, my Achilles flared up. I think that's the one all runners are scared of, though, right? So it's like
Yeah.
your Achilles starts bothering you. You're seeking help immediately,
Yeah.
which is what you're supposed to do. Don't let that thing get too far into a wear and tear type situation.
What are some like prehab and rehab things for Achilles? I don't know if I've ever dealt with Achilles, fortunately, but
Good job.
yeah, I don't.
Yeah. Well, you
doing something.
you strength train a lot.
Yeah.
Yeah.
You put a lot of load on your Achilles doing the 500-pound deadlifts or doing, your training side of that. Well, we talked about this earlier about runners run. The strength training, I think, is a huge part. I think why Achilles flares up here and there.
Really?
Yeah, I believe so.
What are some like? Is there specific movements you can do, like any kind of lower body single leg stuff, or is there certain exercises you'd prescribe? To
Yeah.
somebody?
I like a lot of like plyo stuff, but you have to program it right. You can't just have a runner go out and jump a million times. They're already hitting the ground. Their ground contact time is so much.
Running
if you
is
just
basically jumping.
Yeah.
in a way, right?
One
and
foot to
so
another.
if you just have them kill themselves in plyo, so if they go online and pick out this plyometric workout that's made for someone that wants to jump higher, well, that wasn't made for you.
Yeah.
So you have to program a lot of ISOs, but then also some good jumping movements as well. You can't just tell someone that runs a lot to just go out and just do a million jump ropes or bunny hops. You have to program it right. So a lot of ISOs, some banded pogos, different variations of pogos. Did I do those with you? Where we had a band and then we were jumping? I don't think so, because I think
No.
we were working mostly hip.
Yeah.
It wasn't like Achilles stuff.
By ISO,
So-
is that like isolating a leg?
like an
a single leg?
isometric hold.
Oh,
So
okay,
like getting into maybe a split stance position, getting up on your toes, holding that, right? And like get a little squat or a little flexion in the hips and then hold that for a little bit. You have to do some of these things rather than just plyo. So when I say we program plyos, it's not just go out and jump as many times as you can. It's you have to do it right for runners.
Yeah.
Yeah.
I would say like one interesting concept when it comes like to Achilles tendonitis is like you see all like the plyos and you see all the base movements of what you need to do, but like the Achilles structure like itself, like it has this term called like Achilles torsion. So like when the tendon's like coming down and attaching to the heel bone, the calcaneus, it actually rotates from the outside in, so it twists a little bit. So like being able to this is where we're talking about the movement variability, being able to program some variability into the plyometrics is just as important rather than staying straight vertical with a lot of your plyometric of training. So it's like, making sure that it's not just one facet that kind of like hits like, all right, let's do all these heel raises, let's do this soleus strengthening or what have you. You actually look at the structure and kind of put these abnormal forces on it, because like even imagine like whenever you're running on your toes or whatever, like your heel is still moving, it's inverting and it's everting a little bit. So there's things that you need to be able to manipulate in certain ways just to structurally make it more sound rather than just doing a traditional up and vertical type of training.
Does that involve like just doing like side lateral movements and like going across planes?
Yeah, being intentional with it for sure, like adding the different planes of motion into how you're doing it, getting into those awkward positions, trying to work on some push off when you're in those positions, I think is like a big thing for it as well.
Do you have to do those things with load, or can you do it body weight?
Both.
Both, yeah. You have to have some load to it.
Yeah. Like, I mean, simple things like coming down from a box jump, stuff like that, or where you're adding like your time in the air from gravity, pushing you down, increasing the amount of pressure that's actually coming through the Achilles, and then manipulating the surface on which you land and how you land, where the foot lands. Because I mean, if you do a lot of trail running, like your foot is never straight, actual on a flat plane. Like you're hitting a rock, you're bending, you're twisting. So actually being ready for those, because like imagine getting 99 miles in your 100-mile race and then stepping on a rock and twisting, you're like going to not be able to do the last mile.
Right.
You know what I mean? Like trying to, like what we talked about earlier, like set yourself up for those awkward positions, awkward external loads, and preparing your body for the unknown
I like that. So you guys do a ton of different recovery things, obviously. Like I saw on your website, you've got like blood flow restriction. I feel like everybody's talking about blood flow restriction.
BFR.
Yeah.
Is that
Everybody hates it.
is that-
Love-hate relationship in here.
Can that be used as recovery as well as like strengthening too?
Certainly.
Yeah. So blood flow, it's like the ultimate hack. It's amazing.
Really?
So I did my capstone study on blood flow restrictive training.
Oh, interesting.
Yeah. So I absolutely love it.
Is this a newer concept?
No, it's been around. Yeah, it originated even in Japan in like the 1940s. Like it's an older thing. But they started getting tested and everything in like the 80s, and then I would say over the past like 10 years, it's really been popular. And it has a lot to do with the technology advances. It's more accessible to do it.
I've seen those like cuffs you can wear.
Yeah,
You guys have those?
yeah. We have a set over there.
Right on the wall.
Oh shit.
Yeah.
I go grab those things and patients just start shaking their head.
Does it
They're like-
hurt? Or I've never done it.
It's intense.
It does hurt. It's not fun. I mean, it makes you do like 3 simple exercises with those things on, and you're like dead. I mean, it just takes everything away from you.
Really?
Yeah.
It's like it's a way that you can kind of manipulate some adaptations. So like say that if you're in like doing a very explosive movement, like saying a heavy, like almost like your 500-pound deadlift, for example, like that's a lot of load on your body for certain tissues. And when you're injured or have a flare up, you ain't going to be able to do that same load. And a lot of that times it has to do with the amount of oxygen that you're able to consume to type into your type 2 muscle fibers, which are your big, more explosive and non-postural muscles. So like when you limit blood flow, you create that like synthetic environment of that specific exercise, and then you don't even have to do load, but you get the metabolic adaptation of it. Does that make sense?
Yeah, totally.
Yeah. So it's like a little trick of the trade, but hindsight, bro, it's definitely not better than heavy load.
Really?
Heavy load is superior all the time.
Yeah.
But it's a great freaking tool.
It's a great
tool
tool.
for recovery. Great. It helps. I mean,
It's a good supplement, right?
Yeah.
To supplement that with it, but you can't just take away heavy load.
yeah. Like the cool thing about that is that there's some hormonal effects on it. So it helps like increase IGF-1 and some growth factor. So like a lot of times, like say if I had someone in like immediate post-op for their left shoulder, I could throw BFR on the right shoulder and have them do presses and then help increase some of the hormonal responses to accelerate their healing on the left.
Interesting.
Yeah.
Is there any benefit to somebody doing it like if they're totally healthy, if they don't have any kind of restrictions? Is there any benefit for that, or should it mostly be used for recovery or something?
I mean, it depends on your training, right?
Yeah.
Depends on
bodybuilders,
what you do.
people
Yeah.
utilize it all the time. They're healthy, but they're just trying to get that like extra step into what they're doing for their adaptation change for their muscles. So I think depends on what you're utilizing it for.
Yeah.
Yeah, a lot of times they'll use it during their deload process, like before they go on stage and stuff like that.
Get a pump.
So that they don't lose size or anything like that. They can keep it. So it's a strategy.
Yeah.
It's a tool that you use as a strategy. It's like everything that we do. I always say it's like we're basically playing with a strategy game every time you're in rehab. How do we strategize to get it back to where it needs to go?
Yeah, I've been wondering if there'd be a use for that because I'm training for that 100-mile mountain race.
Mm-hmm.
And it's a lot of downhill, so a lot of like eccentric on the quads.
Mm-hmm.
And I'm wondering, like, there's obviously not a lot of mountains in Austin, so trying to train that eccentric strength in my quads, like I wonder if there's any benefit to BFR with that, or if it's maybe
I
not.
don't know if I would necessarily utilize it for that specific. I mean, other than just doing that type of work, trying to go downhill as much as possible to prepare yourself for it,
Right.
and then through like having high quality eccentric based training in your training methods,
Right.
I'd say would probably be a better benefit than
Okay.
trying to throw BFR and do those same things.
Yeah. Could you run with those things on?
Nah, dude.
You're not running with those. You're not running far.
Yeah.
I think somebody was telling me they like, they probably didn't know what they were talking about, but they're like, yeah, you put them like on your quads and then you can get like a crazy leg pump while you're running. And I'm like, I don't know. I want to ask these guys about this.
They
but it
do.
doesn't
So
sound-
like ours are probably more of not probably. Ours are the medical grade ones. I think what are the ones they make for training that are just a band?
Like they have like pro cuffs that
Right.
you can just wrap.
It's just like a
That's what
it's
I've
like a
seen.
just
it's a
wrap
wrap.
it tight.
So you could probably put those on at a moderate level and probably go run.
Is it gonna do anything
I don't
for
know
you?
what it could just be eyewash at that point, but I'm not sure.
They have protocols for cyclists that can do it cycling. And
If it
stuff
helps
like
you
that.
though, do it.
That's
You know,
right.
that's what we talked about earlier. If
Yeah.
a runner came in here and was like, "This is what I do to hit this time," all right, keep doing it.
Yeah.
Like, I'm not going to tell them no.
Yeah. Yeah, they have it. You can use it doing a cycle, like if you're on a bike and stuff like that. But I don't know about actual running.
Yeah.
You can do some sled pulls with it for sure.
Yeah, sled pulls.
Do you guys have a sled in here? Oh yeah, right there.
Yeah, and we got one
and
out
then
in the
we
big
have
gym.
I want to get
big
one of those
ones
ones
out
with the
there.
wheels where you like set the resistance.
Yeah, those are
Down
nice.
my street or
They're
something.
expensive though.
Expensive.
I haven't looked into them that far.
Good
I
good
wanna say
$1,800.
Yeah,
I was
that's a
gonna say,
write-off.
I like two.
Yeah.
Yeah.
What are some other recovery things? I know recovery is like so popular right now. It seems like with like ice baths and saunas, and I know you guys are building out like is that a
Little
whole like recovery
room.
room basically?
Yeah, specifically for that.
What are some key methods you guys have seen a lot of progress with?
Like let's see. I feel like that's a tough question.
Especially
sure.
for recovery.
Yeah.
I mean, it's so subjective.
Yeah.
Like, what is the key like recovery tools?
Like, is there like things that seem to work for a lot of people, or maybe if it's I feel like everybody's just talking about like soreness and like the percussive therapy and foam rolling stuff like that. Is there specific things like that?
I think
maybe not like an injury per se, but
Movement.
yeah.
Yeah. Well, when if we look at our
Move.
side, if we're not looking at our side on like recovery, right? We're just looking at like modalities that you could use. I think find yourself a routine that you really like, whether that's the sauna, cold plunge, Normatex, and stay consistent with that. And I think you're going to see results with that type of therapy for yourself or self-care.
Yeah.
I think it would be super important for any athlete, endurance athlete, high school athlete, but you have to be consistent with it. I don't think that you could just do cold plunges like every once in a while or hit the sauna just because you're sore that day. I think you have to be pretty consistent with it, but all that stuff is great. I don't think there's any rhyme or reason which one it would be best for you, but it's a feel thing, right? Like I don't like being in a sauna very long.
Mm-hmm.
Jimmy can sit in there for 45 minutes. I don't like
Suffer.
it. I feel terrible if I sit in there for 20 minutes. Yeah. So 10 minutes for me, I feel great. Anything more than that, I don't feel good. So it's like a feel thing, right?
Yeah. I would say a lot of it, like at the end of the day, move, high quality sleep, and then turn around and eat high quality foods and get good vitamins in you. Like that's what's really going to boost the needle for you.
Right.
Get you some good electrolytes.
Yeah.
Hey.
You gotta know somebody.
Switchback.
Yeah. There you go.
Yeah, that holistic approach seems like the best way.
Yeah.
And movement specifically. Like I told you, I don't ever stretch. I don't foam roll. I don't use Theraguns. I don't feel like I need it because I just like walk. I'll go for like a 30-minute walk with the dogs, and I don't feel sore afterwards. It's like, is it just the blood flow that comes from that, or like all the lubrication of your joints and everything, or what is so powerful about the movement?
Yeah, I mean it's like a way that you can just flush metabolites out of your body and then like provide nutrients to damaged tissues. You know, the whole rice thing that you're kind of talking about, alluding to earlier. It's like a lot of the cold therapies, they restrict the blood flow to areas. So, and I'm talking like local, not like an ice bath or anything like that. But that's like why they kind of got away from it, because even logically it doesn't make much sense. You turn around, you restrict blood flow, you restrict like nutrients being delivered and then being wasted away, like being flushed out. So you actually want to open them up and use them and get them to move as much as possible for those type things.
That makes sense.
Yeah.
What if, so say somebody's out on a run and they like roll their ankle, they come back home, like the typical method is like put ice on it and elevate it, stay off of it. What would you recommend for that?
It depends on how bad it is. Like if it's like so painful, like it just throbbing, that's when ice is actually appropriate. It's going to slow down the nerve conduction. You know what I mean? So it's like you're going to perceive pain a lot less, and that's important. Yeah. But usually it's like, don't be scared to step on it and try to move. Like if it's not broke, you know what I mean?
Right. Yeah, 100%. Put pressure on it. I think there's like this thing, you know, playing basketball growing up, you like tweak your ankle. They always tell you just like lace them up like tighter and walk on it. Yeah. And you know, looking back, it's like that's actually one of the better things that you can do is you know, get a little compression on it is fine, but put weight, get your body to adapt and move. Like you have to do that. The more you stay off of it, it's not going to get better with just elevating it and icing it. That's not the right approach to start. You got to move it. Obviously we're not talking about you have a stress fracture, you know, or some type of compound or, you know, something crazy, right? We're talking about the typical just like little tweak of an ankle. Move on it. Don't be scared to walk on it.
Okay.
Put body pressure on it.
Yeah, I always say motion is lotion.
It
It
is.
is. It's true.
Dude, that VO2 Max test. Can't
breathe.
my throat killing me. Speaking of VO2 Max, dude, I've been suffering over here. That thing wiped me out.
Ready
He's
for go home,
he's
go
like a
take nap?
zombie over here.
No.
Hey guys,
See-
what's this next question?
So in addition to all the like PT and stuff, obviously you guys are doing more testing like with the VO2 Max. What made you guys want to get that to begin with?
I think that it was just our collaborations and partnerships that we have.
Okay.
They kind of brought it to our idea, and then we kind of, with our community that we already serve, I think that it fit well with the runners. It's like, oh, okay, we get this. We know we'll have some people interested in to do it, and for sure, and having the capacity to do it is like another big thing. But I mean, it's awesome to get the data and kind of look at the data like we did earlier. I think it's important to kind of understand where it's coming from. And I think that it's an experience that you don't really get much other places.
Yeah. Is there any other place in Austin that does
I'm
VO2
sure,
Max
I'm
testing?
sure
there is.
Yeah.
It was just a good opportunity for us to capitalize on something that's cool. It helps us with our connection with our partnership of a health and wellness doctor that we love so much that it's one of those things that anytime you can partner with good people and move and align on it together with stuff, like take advantage of it, do it, right? Like that was just an opportunity that was a good thing, and we just sure.
What's the benefit of knowing your VO2 Max?
Like we talked about, like for one, you can do a lot of training parameter like modification off of it, so you can actually dial in on your training a little bit more when you have your actual levels taken. There's that longevity perspective of it, which is like super important, and then you can kind of like do the constant monitoring of it. So like typical, like for someone like you, you would want to do like one every 6 months, not often, then some people, they can do it quarterly. It just depends on like where they're at in their life cycle, I would say. But I mean, you get a hone in on certain things. Like the big thing about it is whenever you get an accurate zone 2, like the issue with majority of normal people is the amount of visceral fat that they get around their organs, and then it causes dysfunction, and it can lead to potential diseases. It's like when you get a chance to train in that zone 2, that's where you're optimal at burning some of that visceral fat and like getting rid of that and improving health metrics. So it's like the VO2 max is great to know, but it's also in like contingents with knowing all your lab work, all your blood work, and being on top of your health. I think that's the way we use it the most. Yeah. It's not for the leaderboard of who has the highest VO2 max. It's more of like trying to give the patient the information. It's like, hey, this is what we want to do because we want you to be, like healthy and live a long time and try to live a fulfilled life doing what you want to do. And you got to take these parameters and kind of base your training around that a little bit.
Yeah, I've heard VO2 max is, as far as we know right now, like the number one metric that'll determine your like physiological age, basically, or your biological age, and what your life expectancy would be, which I think is so cool. And we know ways to improve VO2 max, which is even cooler, I think.
Yeah, I don't want to see mine. So,
well, I think it's. I've also heard like push-ups. Have you guys heard this? That like the amount of push-ups you can do is pretty much directly correlated to VO2 max, also directly correlated to how long you live. Have you heard that?
I
haven't heard that one. I've definitely heard plenty of different things of like, can you sit and stand up without touching so many things, and that would give you your life points, right?
Yeah.
I think all those things are good. I mean, you got to be able to test yourself in one way to see where you're at in life. And if it's for one patient to go do a VO2 max that like that's their wake up moment,
right,
then that's what they needed, right? And maybe for you, it was more of like, where am I at right now, and how can I go further with my training? Or someone, maybe it's somebody that's like, dude, I'm completely out of shape, but I'm just gonna do this and see what it is. And then when you tell somebody's like, this is the data, and it's not good. Yeah, that's how you make change with people, and people start making a positive impact towards their own life. So I think it can have that impact for people as well.
Yeah, you can't really argue with objective.
I mean, I just saw someone do it, and I was like, dude, mine is going to suck, so I'm just going to start running now.
Work on it.
Like, I just need to work on it right now. So,
dude, when you do it, call me up here. I want to watch you go down. I want to see somebody else do it, like, in person, now that I know what it's like to do it.
Yeah.
I want to watch somebody do it. Because I don't know if I would have done it if I saw somebody do it, like, in person.
Yeah, you would have.
Yeah.
Yeah, you would have.
Oh, yeah. What a cool test, though. Do you guys plan on implementing anything else like that here to give people more resources to test things like that?
I mean, we started adding a bunch of different things where like we're trying to, like we talked about, trying to make it as holistic as possible. Like it's not just a rehab facility.
Yeah.
So we added some diagnostic imaging. So we're actually trying to get better at utilizing some diagnostic ultrasound, so we can actually look at integrity of tendons and ligaments and like muscle tissue, which is super cool. We have the recovery room being built out, so we have the red lights and stuff like that added into it.
Is the red light stuff legit?
Yeah.
Really?
Yeah. Have you ever read anything on it though?
I've never looked into it.
Yeah.
It just seems...
Look into it. It's actually pretty nice. You
Yeah.
got to get a high quality one though.
Okay.
You can't
you have
go
to
cheap
spend
on
the
it.
money on it. I was definitely a naysayer to red light for sure. But then, it's one of those things you let everyone talk first to get an opinion before you actually like say that this doesn't work, because it's like you're shining a red light on yourself. Like, oh, what are you actually doing? What do you feel? Right. Because like we're like that, or I'm like that, how I treat. Like I do things where people feel, because that's how I know something's working, is when if I was to go to therapy and they're digging on me really hard and they're doing this, I'm like, oh, we're getting something done, right? Yeah. The red light is definitely not that. You don't really feel anything other than maybe a little bit of heat. But I've heard a lot of smarter people than me talk about it.
Yeah.
And then when I've seen kind of that implemented with people's rehab, and seeing a lot of good results with it, it's something you just can't argue anymore. It's like, okay, let's do it.
What does it do? It's something with your cells, right?
Yeah.
So basically, like the red light gets absorbed into your body, right? And then like that absorption kind of like kickstarts like the mitochondrial process, so they can develop more ATP, and it helps with the healing process of tissues. But at the same time, like don't forget, it's a tool in the toolbox. It is not going to fix anything. It's like you got to do other stuff.
Right. It's not a heal-all.
Yeah.
And I think that's where I think sometimes even I get caught up on that, of just being like, well, it's not a heal-all, it doesn't work, right?
Yeah.
Well, that's not the truth, right? Like just because you think it's doing nothing in that moment, but compounding with other good tools or other good movements and stuff like that, you're going to give your body the best ability to be at 100%.
Yeah.
And I think you just add it as a good tool. And I personally, it's one of those things that like, have I used it enough to see like some crazy benefit? No, but I hop on it as much as I can to try to get whatever benefit I can out of it. Right?
It's all those like little 1%.
1%, baby.
100%. Yeah.
Yep. I love that. Damn, I'm telling you, my voice keeps cracking. And then the RMR with the VO2 Max, it's all in the same machine.
Mm-hmm.
What's the benefit of the RMR, or what's the benefit of knowing that number?
Yeah, like I think it's kind of like what we discussed earlier. It comes down to knowing where your actual resting metabolic rate is truly at on your calorie intake. And there's some interesting like anecdotal stories that we have about it. Like I had one person come out, they did it, and they were actually exposed to mold toxicity at a young age. So like they had a respiratory rate that was extremely low, because you get to the point where your body adaptively starts to slow that process down, so you're not inhaling those like molds. So getting able to like kind of pick out some of those like situations, like, like you're going through a 12-minute cycle where your respiratory rate is getting measured. It's measuring the amount of oxygen intake and then CO2 output, and being able to get your calorie idea around where you should be at baseline, I think is powerful. Some people are surprised by it. If you have more muscle mass, typically you can have a lot more calorie consumption at pure rest because of the muscle itself.
Right. Fat doesn't use energy, right?
Yeah, no. There's no biological like mechanism that it utilizes. But being able to know those metrics, know where roughly you should be able to eat at. For what we talked about, it's like probably we undereat a ton, and most of the time you think that you typically overeat, but then when you kind of see it, like, dang, I can consume 2,300 calories doing nothing. Like it's hard to eat. I don't know if you ever been like on a strict diet with a high calorie. It's hard to get calories in like that when you're eating good foods. You're eating Snicker bars and McDonald's stuff like that. It's easy to go over. But when you're living a healthy lifestyle, you don't realize how much you really need to eat, especially when you're active.
Oh, definitely. Yeah, I think most people that exercise in general are probably under eating.
Yeah.
Especially if it's for performance purposes.
Oh yeah, for sure.
Yeah. Like I've done the online BMR calculator or RMR. Is it BMR or RMR?
RMR.
RMR. Okay.
Yeah.
What's the difference between that and BMR? Is basal metabolic rate?
Yeah, they're practically the same things.
Okay.
But I mean, one's more of like BMR would be more appropriate to call it that if you woke up and you got here and did it. Like within minutes of waking up and doing it.
Okay.
But you got up, you moved around, your energy system started kicking off. Yeah. So it's like there's some type of metabolic process that kind of went on. Basal metabolic rate is like that pure definition of organ function and brain function, only thing doing anything else. You know what I mean?
That makes sense.
Yeah.
Yeah, I've looked up before and it said I was like 17 or 1800 and then calories per day, right?
Yeah, per day.
And then today was like 2,300, I think.
Yeah,
so
got some muscle mass on you,
way
baby.
higher than I thought, which is interesting. I just got to eat more.
Yeah.
Yeah.
Eat some food, man. Dude, it's great. Grass
so
fed, some
yeah.
raw milk.
Of course.
Yeah.
On the side.
Damn. What do you guys think is the big vision for Helix? Do you guys have a big goal you guys are trying to, like, 5 years we want Helix to be here?
Yeah, honestly, I think it's just, impact as many people as possible. Like, help as many people that need to be helped. I mean, at the end of the day, it's like, if we do that, everything's going to go right. And there's no true rhyme or reason to, like, the ultimate business plan to being like a nationwide recognized brand or anything like that. Like, if we just keep our ideas or our mindset on, let's just treat people that are looking for help and try to give them the best possible treatment, I think all that stuff takes care of itself.
Yeah, I think we provide a unique way of PT, chiropractic, everything together. And, with all the feedback we've gotten, it's definitely one of those things that we definitely want to expand and grow. So there's more opportunities coming up of expanding. So when we get into those like phases, those are just different milestones and challenges that we're going to have to conquer those months and days. But you take a leap of faith each time and just keep growing. And we got to just grow the right way, right? And we got to keep the main thing. And I think if we just keep pushing with the same kind of model that we talked about, being relationship driven, even into our next clinic, and then how we hire and stuff like that, I think we could put up some decent clinics in this area. I don't think we'll ever get to a point where it's just like a franchise thing. That would be past our vision, but we definitely want to grow. And I think we see at least 3 or 4 clinics in the next 5 years. That's kind of at least the goal of, like, I think what we going to set out for ourselves is being successful on that aspect of, like, expanding and doing that stuff. I think 3 to 4 clinics in 5 years is a good metric for that for us.
Trying to give people the access. You know what I mean? Yeah. It's hard to drive all the way out here to Lakeway. We understand it. So if we can get access to other people in other locations, I think that's where we really hit home with what our vision truly is.
I like the drive out here, though.
Yeah, it's gorgeous,
dude. It's too flat where I live.
Yeah, it's gorgeous.
There's actually some hills out here.
Yeah, we'll get closer to Austin.
Yeah.
Maybe coming up soon.
Yeah. Do you guys do anything like remote if somebody like doesn't live in Austin? Do you guys have a way for people to like work with Helix, or does it have to be in person right now?
Yeah, I mean, we have set up for telehealth, so we can do like online visits and stuff. I mean, definitely, it's harder. Yeah, it's definitely harder because you still got to go through stuff. But if it comes down to that management of the issue, we can still do those type things. Right. I still think that there's something special about going in-house to location and getting stuff done, rather than just giving you 4 or 5 exercises and say don't do this, do that type thing.
Yeah.
I think there's definitely a lot of ideas that we have like talked about of doing like some online protocol type stuff, or online therapy of like typical sprain of ankle, right? We have something for that person that's in Amarillo or something that just knows somebody that knows somebody that knows us, and he's like, I want what they got, right? But at the same time, we can't overload ourselves with stuff right now. We don't want to get too crazy. We keep the main thing for us right now, and then eventually that will come. But it just hasn't been the right moment for us to really expand into that realm. We definitely want to do it. We've talked about it plenty of times, but it's just about doing it the right way.
Heck yeah. Well, you guys are killing it. I mean, obviously making a huge impact.
Trying to,
man.
Yeah, you guys are crushing. I'm excited to see where it goes in the next few years.
Yeah.
Like, I used to know this guy.
Yeah.
Another big time.
Yeah. I forgot all about
I'm
me.
excited for you, man.
Yeah.
That what you've done with running and like your podcast that you're doing that. It's been awesome to watch because like we talked about when we first there, like the first or second visit I've seen with you, you were talking about doing this, right? And now you're 40 podcasts in.
Yeah.
And I think I mentioned maybe one day me and Jimmy would be cool enough to like come on the podcast. You kind of laughed and you're like, yeah, maybe one day.
I didn't mean it like that. I probably more meant to like, as long as I keep doing the podcast, I got to figure it out on my own end first.
Yeah. And then when you asked us, I was like, wow, didn't even take a year. Let's
Look
go.
at us
Let's
now.
do it. Yeah.
Moving fast, man.
I love it.
Don't
man.
let that grass grow under your
Dude,
feet.
I think good things happen to good people. Just keep taking care of people, keep making a positive impact, and good shit will happen.
Yeah, dude,
Always.
people notice good things.
Yeah.
Right? Like people are not dumb. You know, people understand when something is organic and real, and when you are about positivity and the type of mindset that you have on your channel and all that stuff, like people fall in love with that type of stuff, right? Like people want that in their life, and so you've been crushing it with that. So
thanks,
I
dude.
think you just, you keep doing that. I mean, there's no way you can't succeed with whether you're running a podcast, whether it's us in the physical therapy world. People see that and they want to be a part of it. So
I love that.
That's cool.
Dude, let's end it right there. That's great.
Yeah.
If anybody wants to reach out, connect with you guys, where's the best place to do that?
Text. No, I'm just kidding. Don't
Just
text.
give them your home address.
Yeah. Our business numbers on our website, but website submissions are really good because it's easy for me and Jimmy to see those submissions and then actually have the time to read a little bit about what's going on, call you, and have like a good game plan going forward when we talk on the phone. But just our business number is the best way to reach out, and we are unique in a way that we text with our patients. So don't be afraid to shoot our business number a text message about kind of what's going on with you, and if you want to get an appointment soon, shoot us some dates, and we'd love to get back with you and see how fast we can get you in and get you better.
Heck yeah. Beautiful. Thanks for coming on, dudes.
Yeah, dude.
Thank
awesome.
you.
It's
been really
fun.
cool.
If you guys are in Austin or local here, definitely come check them out because they're good dudes doing cool things. So
Yeah, man.
thank you
Appreciate
guys.
Yeah.
All right. Goodbye, everybody.
Thank you so much for tuning into the show. If you enjoyed this episode, please make sure to subscribe to the channel, leave a review, and share it with a friend. We'll see you in the next one.